Welcome to the Unapologetic MidLife Podcast. I am your host, Mindi Lobuzzetta, and today I am joined with Andrea Tallchief of Chief Aesthetics. And Andrea is a board-certified adult nurse practitioner who specializes in medical aesthetics. And I know a lot of you are going to have questions out there today, and we have the perfect person here to answer all those questions. Welcome,
Thank you.
Andrea.
Thank you. Thanks for having me.
You're welcome. So I am a licensed esthetician, but I don't work in the field anymore. And I've been getting a lot of messages from the state regarding, illegally owned and operated medical aesthetics businesses. And I have seen a lot of moms and women getting on these mom groups asking, where are we getting the cheapest Botox or where are we getting the cheapest filler? And I like to emphasize that that is not the approach that you want to take to this. And I thought having Andrea on would be an awesome way to discuss what you should be looking for in a provider. And you do an amazing job. And let's dive into it.
Yeah. So obviously, laws vary from state to state. In fact, I think New York State gives us a lot of leeway, especially as a provider, as far as practicing for a certain amount of hours. And then you actually can be independent in the state of New York.
Okay.
That's how I was able to have my own business. And not just medical aesthetics, but even my primary care physician. She's a nurse practitioner, owns her own business. So the laws vary. As far as illegally run practices, I'm sure they're out there. I think the majority of them have been in New York City, if I'm not mistaken, but the laws change and people still do whatever they want. So we really are big on trying to be by the book.
Mm-hmm.
In fact, even microneedling changed. You have to be under the roof of a provider to do microneedling, where everyone and anyone's doing it. So it's kind of crazy what's happening, especially with other medications like peptides and things like that, not even having a physician in the same state as you and you're
Mm-hmm.
selling it. You're not even a licensed, provider. I know people that are, in gyms and hairdressers, and it's just everyone wants to be a doctor.
Yeah.
It's a little
Yeah.
scary. And not that people are not knowledgeable, because people are, but you have to, some people don't care, which is a little sad. And
Yeah.
I do think that you're going to get a different treatment from different people. But as far as legalities and, falsely things, I don't know how to stay, I don't know what people are promoting. There's scams everywhere,
I mean,
so
looking for credentials, right? How long have you
of
been in
course.
business? What led you to where you're at? I think looking up a license number, right? How
Sure.
is this establishment operating, right?
Yeah, you
Is
can go
this
on the New
legal?
York State, Office of Professions and
Mm-hmm.
find nursing license, practitioner license, all of it. So
Therapist. Yep.
yeah,
Everything.
if people want to do their blade work, and then some people don't care. But it
Some
is a
people don't
shame,
care.
that, fake Botox or, people will sell you anything.
Yeah. Yeah. And the scary part of that is, Botox, it's a neurotoxin, right? It's awesome. I'm a fan of it. But it can also be very harmful if not used in the appropriate way. And you're injecting something into your face and into your body, and you
I
can't
could
take
tell
it
you
out once it's in
crazy
there.
I could tell you crazy, crazy stories. And I mean, I had a patient injecting herself with some stuff that she said was from Korea. She not licensed in any way, shape, or form, and not even in skincare, and said, well, I've watched 100 videos. And she comes in with bruises under here, which I said, it doesn't even go there. It just,
Yeah.
you're not a good patient for me. I had another patient who moved down to Florida, did her own under eye filler, has no medical background. I said, you have no idea the amount of risk you just put yourself in. I can only advise you so far. I will help you find an injector down in Florida.
Yeah.
If you bought Restylane online, it's not really Restylane.
If you're not a licensed provider purchasing it online off black
Yeah, you
market,
have to.
whatever.
Yeah, in order for me to get any products, I have to have my medical prescribing license.
Yeah. Yeah. It's really scary. I mean, you lose your eyesight because you inject something and damage a nerve around your eye. It's not
Oh,
coming
it's more
back.
than nerves, girl.
Yeah.
more
Yeah,
than
no,
her.
it's scary. It's scary.
Yeah.
So, I always want to strongly encourage to find somebody like yourself who is licensed, who follows like not just ethic laws, ethics and laws because they're separate. And again, if a patient is not appropriate for your care, referring them elsewhere.
Yeah, and I feel like obviously I want patient retention and I try to keep
Of course.
people with me, but sometimes we don't see eye to eye and I'm okay with saying, are you sure that I'm the right fit for you?
Yeah. Yeah, because it is about the patient. Correct.
I will say the majority of the time they will come back,
Hmm.
but
Which is good. What led you into medical aesthetics?
so, well, with trying not to be too long of a explanation. So, I've been suffering with my own autoimmune disease, atopic dermatitis or eczema. I've suffered with it since I was a baby.
Okay.
So, I have a lot of empathy towards people that feel uncomfortable in their own skin.
Mhm.
And I really truly want to help people as best I can, whether, I understand what it feels like to not feel confident or pretty, or actually you just feel really uncomfortable. Anyways, been there, done that. And so I always had a passion towards that. I always loved plastics. I always loved a good before and after. I
Mhm.
know it sounds crazy.
Nope,
I
it's
think this is a
great.
little, I think this is a little over the top, but I'm probably aging myself. But there was a show called The Swan
Mhm.
where they would do all this plastic surgery and all this stuff. And I loved the before and after. Same
Yep.
with even like Biggest Loser. I love people that can transform themselves and feel confident and feel good about themselves and be healthy and whatever. So I was drawn to it and I loved nursing. I wanted to get into nursing. I loved bedside nursing. I was an ICU nurse for 8 years. I've been a nurse practitioner now for coming up on 12 years, which is
Okay.
crazy.
Yeah.
I love giving people their confidence. And if it's not, about wrinkles or fillers or whatever, just making someone feel comfortable if regarding whatever their issue that they have. I've had patients that have had facial surgeries, that they've had nerve damage that causes contraction on one side, relaxation on the other, and they're uncomfortable, not just
Yeah.
asymmetries, but they're uncomfortable.
Yep.
I'm trying to help someone just feel comfortable or headaches or jaw pain or whatever.
TMJ, right? You do that.
Yeah,
Yep.
all of it. So more than just that, I love being able to help.
Yeah. I think when people think of Botox, they think of cosmetic, but I know recently on your page you had a gentleman that had cancer and he came to you to help give him some confidence. And I love that because now we're also highlighting men and their confidence with the way that they look too. Because I feel like
Yeah.
men typically, they're kind of like a pat the water kind of
Listen,
their
they can like
routines.
not wash their face
I know.
forever and
I
their
would
skin is great.
It'd be a giant pimple. I could never. But, them coming in and also wanting to feel good and look good and how important that is. So this isn't just for women. This is for our men
Right. And
too.
for him, he was a really special case. I do consult with other patients of mine that are in plastics or friends of mine that are dermatologists and vice versa. If we have a case that we need a little help, I think it's super important to
Mhm.
discuss a case because sometimes we're on an island on our own.
Yeah.
But for him, I've treated him now. In fact, he was in yesterday for a touch up. I saw him 6 months ago. That picture was from a while
A while
back.
ago. Yeah. He gave you
Um,
obviously consent to
he
post it.
so he had significant surgery. He had lip cancer. He's a landscaper. He was very taken back at how he looked after surgery. He had no idea the
It's going
extensive
to
amount of work
entail.
to get done. And he said he Googled someone close by, which is funny because we have a lot of mutual friends, which is
Mhm.
Buffalo small.
Yep.
But it was nice to, and I feel bad every time I get done with him. He cries because he's
Aw.
like, he feels so good and he went through so much trauma.
Mhm.
So I love being able to just give someone confidence, but he was a specific case. I had to tread very, very lightly with him because where his vessels lay,
Mhm.
I actually changed my technique from the first time I treated him just for safety purposes. And I said, listen, I can't be as precise, but I'd rather be safe than be
Mhm.
even more precise because
Yeah.
it's just a bigger factor. So I just kind of changed my technique with him.
Yeah. But that's important. I think that says a lot about you as a provider, right? I'm not just going to do this just because you want this. We have to do this and do this safely
Oh,
and also
100%.
give you an outcome that you're happy with. Because I think that there are injectors out there that'll just do whatever and then you see people and I mean everybody's got the internet, right? It's like, "Oh my gosh, who's injecting that person?"
Yeah, exactly. And I have people that will still come here and they want more than what I want to do. And they know I'm very vocal about
There's risk.
not just risk, but it's my name. Your patients are your advertisement. Please don't tell anyone that I did this because it's not my taste of work. I don't want to be rude, but I also want to be honest.
Mhm.
And so sometimes I have to draw the line of, hey, you can't book for that for a while.
Yep. Yeah.
I
Yeah.
think sometimes you get filler blind.
Yep.
And then
Yeah,
that's
more
where a provider needs to come in and say, no, I think you should wait or you don't need that yet. And I could sell a lot more syringes, but
mhm.
I wouldn't be able to live with myself.
So I think ethically, right, you have
Right.
boundaries on how much you're willing to do and limitations. You have to be able to tell somebody no. Yes, you have a
100%.
business, but this is also, like you said, the face of your business are your clients.
Yeah. Honesty is my biggest. I mean, you've been my patient for a long time. I like to be really straight up.
It's really important.
Mhm.
Let's talk about because this is obviously the unapologetic midlife. Let's talk about midlife skin. What does
Yeah.
this look like in terms of medical aesthetics and what are things that you're recommending for people?
Yeah. So it's funny because patients in our age group will
Yep.
say, I'll hand them the mirror and they'll go, I feel like it just happened in the last few months. I
Yep.
feel like my face is sagging. My eyes look dark. I
Yep.
don't know. They describe it as coming out of nowhere and
Mm.
whether they're actually going through, hormonal changes, which most likely
Yep.
they literally come to me and say, I feel like this just started happening. My face is falling. So you actually lose. I knew that we were going to chat, and I don't know what I did with the statistics, but it's between 40 or 70% of collagen loss starts during perimenopause and menopause. So it's the truth. When they come in and say, I
Yeah.
feel like it just started and my face is falling, it's like, yeah, because we're just rapidly declining in
Losing. Yeah.
collagen. Yeah, exactly. So medical grade skincare is key in my opinion. You can buy over the counter stuff. I don't think that patients necessarily will see much changes in their skin. I do think that anyone in their 30s, maybe mid 30s and older should be on some sort of retinol to help with fine lines and wrinkles. And then obviously doing products that have growth factor in them, something that's going to help stimulate collagen, elastin. I think
Mhm.
a lot of people will take collagen. I say I don't think it can hurt, but I
Okay.
don't know how much it can help.
Okay. Yep. So you're saying that oral collagen, like the powders and stuff. Okay.
I don't know. When things go through the digestive system, you don't know how much you're actually absorbing.
Right. And I feel like too, the genetics have to be playing a role in this
Of
too.
course.
Right. What does your
Yeah, but
mother
you
look
can
like? Your
tell.
grandmother? Yeah.
Yeah, you can tell too though when someone's older and they've never taken care of their skin, they've had sun damage, they have not really done any fillers or collagen stimulators, and they want me to work magic with 3 or 4 syringes. I can get them some improvement,
Mhm.
but some of that is not going to go away. And I think that that's a big reason why patients are getting treated younger and younger, more for preventative. But I
Yep.
do think that it has to be done tastefully.
Yes.
You could be in your 20s getting tox. Maybe you come twice a year. You may not need to come every 3, 4 months. But yeah, I think my preference for a collagen stimulator is Radiesse. I think hyaluronic acids, there's so much nonsense online, in my opinion. I think that everything has its place. They'll say
Mhm.
fillers, old news. Don't use HAs anymore or hyaluronic acids. But
Mhm.
I still think that they have their place
Yeah, I agree. I think it
when used
shifts too.
tastefully.
Yeah, like it shifts, I think, too, for seasons. Like what I use in the summer might be different than what I use in our really dry tundra winter.
100%. 100%. And so I carry 4 medical grade skincare lines. They customize everyone's regimen. You're not going to go home without
Mhm.
knowing how to use your stuff, which,
Mhm.
people will say, "Oh,
It's
I bought
important.
all this stuff and I don't know how to use it." And I'll say, "Well, they put you on an acid and your skin is super dry." And so I like to have those conversations so that I can tailor it for you. Same
Mhm.
with everything else. As far as that goes, we lose collagen and elastin, especially in that age range. So replenishing it the best we can.
And I do think there's something about preventative. So, like, if you're somebody who's getting Botox in your late 20s, early 30s, that's setting you up for success kind of later.
Yeah, you won't be 60 with a deep etched in line that I can't get rid of.
Yeah, because that's harder. It's harder once it's there.
It won't go away. It'll
Right.
soften, it won't go away.
And the other layer of this too is, we talked about genetics, but, habits, drinking, smoking, people who are taking care of themselves physically versus people who are not. I think your skin is going to be your first sign of something not being correct internally, right? There's a lot of
Mhm,
talk about gut being
for
kind of that
sure.
second brain, and how healthy your gut is going to impact your skin. I know that's not necessarily what you do, but I think you probably see that when
It
people
has a
come
huge
in.
factor, and
Yeah.
especially obviously with, peptides becoming more and more popular,
Yeah.
I've started doing those as well. Medications like copper tripeptide, things that are going to help with skin inflammation and hair growth, which are all
Mhm.
concerns in the beauty industry, but also, yeah, exactly what you're talking about, glutathione, detoxing the liver, things like
Mm.
that. You kind of got to stay with the trends and where aesthetics is going. I do think that, for example, hyaluronic acid, as far as the market, is way down in the United States compared to where it used to be, and more collagen stimulators are becoming more popular. And same with peptides. I think it's kind of like a wave of wellness, healing from the inside out, so to speak.
Yeah.
However, there's only so much that me personally, I want to be part of the trends
Yeah.
just because I don't have a passion in it. We do
Mhm.
weight loss management here, but I did primary care for 7 years. So taking care of patients with diabetes, hypertension, things like that, it's a similar conversation, to be honest, as far as weight loss goes. And some patients are using it just for anti-inflammatory purposes if they've got
Mhm.
rheumatoid arthritis. So I love being able to help in that aspect, but there's other
Mhm.
things like hormone replacement and testosterone and stuff like that. It's not my wheelhouse. I don't have an interest in it. I'm not gonna bring it on because
Yeah. Of
I don't
course.
I know many nurse practitioners that are wonderful that I would rather send someone to if they wanna do that, but it's just there's only so much I wanna stay with the trends, and it's easy to go broke in this industry if you
Oh
try
my
to keep up
gosh,
with too
yeah.
much, so
Yeah. Yeah, no, and I think you have a whole array of services, like just even getting into the peptides, because I do think that that'll have a positive impact on the work you're doing with the Botox and the fillers and,
100%.
oil therapy. I know that's something that you do. Tell us a little bit
Mhm.
about that.
Yep. So all therapy is microfocused ultrasound. So we actually read an ultrasound machine while we're doing the treatment. We can visualize subcutaneous tissue, your dermis, your platysma, which is your muscle. We can actually visualize down to bone. So we
Wow.
can customize everyone's treatment. So on that, we use a transducer to scan the dermis, and we can actually visualize where you have the most collagen and
Mhm.
muscle, and so we can treat right specific to that level for that patient so that they get maximum results. I did purchase the machine initially because so many patients did not want to have surgical intervention, right? They didn't
Yeah.
want to go for a facelift. They wanted to try to see what they can do without a facelift. Some people are interested in injectables and some people are not. All
Mhm.
therapy is a great option as a combination treatment or just if you don't want to do injectables.
Yeah.
Yeah, so it treats down to the muscle. It's a skin lifting and tightening. I do have most of my patients do it twice a year. Otherwise, you can do it annually. And I think
Mhm.
it's a wonderful option if you're not interested in surgery or not ready for surgery.
Yeah, 'cause surgery is gonna be very invasive. There's gonna be healing
Oh my
time.
God. Yeah, there's anesthesia. The downtime is outrageous. The healing, the
Yeah.
expense, all of it. And with all therapy, there's no downtime. You
Right,
can
you're
literally
good to
go out
go.
to dinner.
Okay.
And I actually just upgraded the machine to the Prime, so it's their newest machine.
Oh,
So
wow.
it's a little bit less uncomfortable. There's better visualization for the provider doing the treatment. It's a little bit quicker.
Mhm.
Usually patients just take a Motrin beforehand. We don't even numb. And
Okay.
then I do have Pronox here if patients want it. It's nitrous and oxygen that you can suck on.
Laughing gas, right?
Yeah, basically.
Okay.
So you can actually use it for any other treatment here if somebody wants it. So, but
Which is great, right? If somebody needs that or if they're nervous, some people maybe have fears of needles, and this is
yeah,
something
it's
that can
available.
I think that's great. Patient comfort is important. I know you got your little squeeze ball when you come in for things
Mhm.
and, take your deep breath. Like you're very good about preparing a person for what is going to happen and walking them through it,
I
especially
try.
somebody yeah, especially somebody coming in for the first time and patient comfort is important.
Yeah.
Obviously there's no pain, no gain, but there's also,
Yeah, and the big, am I gonna bruise? I said, "Well, I use a needle. It comes with the territory. I'll do my best."
yeah. You do
I have
have
an
that.
Accuvane. I can kind of,
Yep.
sometimes take a moment and search it out, and it's not guaranteed, but I'll try.
I think that there's always risk, right? And I think going into something, you can be the most amazing injector, and sometimes you are going to bruise. It's just going to happen.
Yeah, there's definite risk, especially once you get into fillers. I think that a lot of people nowadays they go to nursing school just so they can do aesthetics. There are, yes, I'm not boosting patients and I'm not cleaning them and I'm not taking them to the bathroom and the downside of nursing. So, I've had a patient have a seizure, I've had patients pass out, I've had, other issues. You have to be prepared, you have to know how to handle it.
Hmm.
You have to keep your
Yeah,
patients calm and know what to do.
and have a procedure like ready if should something not go well or if somebody's
Shit's
not
hit the
handling something
fan.
well. Yeah,
You just have to know how to handle it. And I think that I don't know if it's just not discussed enough in the industry, but everyone wants to take, cute pictures. And maybe it's just not my personality.
I think you're busy, and I think if you get a break, it's nice also not be on social media. It's nice to maybe take your lunch when you have that time.
Yeah. It's a lot of it's part of the business though.
And you do have to post things, right? Because that is your advertising. That is
Sure.
but I don't want you to like eat, breathe, and sleep social media. Like you still have a business to
Oh yeah.
run and you're a mom, you are a wife, you're a business owner. Let's even rewind for a minute. So you decided that you're going to go into medical aesthetics. What did this journey look like? How do you get into this?
So I started training. So I actually found a doctor that was in Rochester at the time, and I
Hmm.
liked his work, and I actually paid him privately to do
Hmm.
some training. And then from there, I did tons of hands on conferences. There was nothing locally. I was traveling. So anytime I would get continued ed money from the job that I was at, I would
Yep.
go do an aesthetics training hands on. And then I was actually listening to I don't remember if I told you, I was listening to a podcast at the time. It was called Side Hustle Pro, and it was all women, typically minority women. And she said, turning your passion project into profitable business. And
Yep.
so it just kind of, I don't really, have the time to listen to a lot of stuff, but I used
We
to
might
listen to,
10 minutes driving somewhere,
I
10 minutes
know.
while I'm in the shower. You gotta do what you can when you can, which it sounds like you were doing.
Yeah, so I would just, I would listen to it on the way to work and I would just listen to a woman that she patented her own hair products. And I said, "Wow, if this girl can go to the library and do her own patent, I can do my own PLLC." So I
Yep.
had friends that said, "Call my attorney, it'll be a couple grand, whatever." And I ended up doing it on my own. It took a little bit longer, but I feel
Yep.
like I'm very proud of the
You
process
should be.
of,
Yeah.
you have to you have to, publish your stuff. And
Don't you have
anyways,
to
it's a
present to
lot.
the professional licensing board? Like there's a
Yeah. And I said, "Well, can I call myself Faces?" They were like, "Nope, you can't. You have to call yourself what you are." So
because of
my
your
actual,
license. Yep.
yeah,
Yep.
I couldn't even do chief aesthetics. It had to be what I am, my name and what I am called. And then you can do a fictitious or doing business
An
as,
assumed name. Yep. Yep.
exactly, exactly. I did that, and then I bought my first 2 vials of Botox. I set up an account and bought Botox, and I tried to look at it and say, "All right, Andrea, pretend you're investing in school, but
Yep.
you're investing in this." And so I just started slow. I was treating friends. I had friends on the couch. Like,
Yep.
you got to start somewhere. I had paper charting, and then before I knew it, I said, "This my papers are going to be crazy high. I cannot. There's no way I can continue this." And then you still perfect it. It takes time
It
knowing
does.
dosing and looking at someone's eyelids and just like their muscle contraction, the strength of their muscles. There's so many factors. What do you
Yes.
want to look like? there's just so many factors when you're treating. It's really not cookie cutter. So, slowly perfecting that. And then the business got so busy that I had major and I quit my other job and decided to give it a try and go full time.
Took a
Yeah.
chance on yourself. You did.
Yeah. Yeah. I mean, I was seeing about 7 patients a week. I was treating patients when I would get home from work. So I'd go
Yeah, your
work.
work. Yep. Working around the
Exactly.
hours. Yep.
Yeah, and I used to get in trouble. They'd be at work. They'd say, "Andrea, you can't take Botox calls at work." "Oh, okay, I won't, I won't." But I had no choice.
Yeah. You're
I just
creating
had a passion
something.
for it. Yeah, I had a passion for it, and it's what I wanted to do. And then it just takes time. So I'm almost, I think, 8 years coming up.
Wow. Congratulations. That's
I
exciting.
know. I
Yeah.
started it in 2018.
Yeah. Well, I mean, 2018 to 7 years. I mean, no, yeah, 8 years, 8 years, 2026 we're in. I'm like, what is a
Yeah,
year?
which it's wild to me. So this is
Yeah.
all I've been doing. Yeah. And then I moved into this office last November. So a little over a year ago, we renovated a small little dental practice and we'll see where it takes us.
Yeah, I mean, it's kind of crazy, right? I mean, I loved your story when you first told me that story of, trying to get in somewhere and trying to work and get experience under anybody who was already doing medical aesthetics and nobody responded to you.
I even dressed up one day on my day off to go in to talk to a manager and no one called me back. Yeah, I applied to 3 different plastic surgeons that were in the area. No
Nobody.
response. And so that kind of started my journey. I said, you know what? If no one's going to give me the opportunity, I'll create the opportunity. And
Yep.
just what do I need starting from the beginning? But it
Yep.
takes time. People want to jump right into it, and it takes time, not even just learning the craft.
Starting the business, so getting the legal setup, because that's really important.
Sure.
Protecting your professional license, gaining a following. And I mean, I think, that is one thing that is positive about social media is you get your name out there. And people ask me all the time, like, who do you go to? Or I'll see in a mom group and
Yeah, it's
I'll
word of
plug you
mouth.
in.
Sure.
Yeah. Yeah. So there are positive things with social media. But I think that determination that you were like, okay, so clearly this one path that I had envisioned is not going to work out.
Yeah.
So I'm going to create this other path.
Yeah.
And you did it. And I
Yeah.
think I think your story is your superpower, right? Because that is your passion behind what you do. And it wasn't like you were just going to sit back and take no for an answer. You're like, no, now I'm going to do
And
this.
there were no med spas. There was no med spas
Yeah.
when I first, I mean, that
It's
was,
exploded since. Obviously, you've been doing this a while now.
oh my God, there's places all around.
Yeah. Yeah. To each their own. There's more than enough people to go around, but
Absolutely.
I think you creating this path for yourself, I think there's a level too when I don't know, I'm kind of like one of those people when somebody tells me I can't do something, I'm kind of like, well, watch me and now watch me do
I'll
it
show you.
really well. Yeah.
Mhm.
And I think that's what you did. I mean, you're right in the heart of Williamsville, right in the village. You have a prime location, you have parking. You have an esthetician, and then you said you have a PA that's with you as well?
She's actually a medical assistant and
Okay.
she is her and I used to work together years ago. She was my direct medical assistant and she's like a little sister to me, but handles patients, takes care of the patients and handles things exactly how I would. And she was
Mhm.
always 2 steps ahead of me and loved working with her. I reached out to her a little over 2 years ago and I said, "Hey, are you back in nursing school? I need some help." And so she said, "I'm actually back in nursing school." And I don't know if she even liked what I was doing at first. Now I think she's loving it, but she'll be finishing up her RN in just a few months. And
Wow.
she's here 3 days a week now. And patients are definitely getting to know her. It's Nahani.
Mm.
And she'll be an RN injector with us. So I've been training her for 2 years now. And she's like a little sister.
What I love about that is you're giving another woman an opportunity that you were looking for when you started out this
Yeah.
business.
She's beyond deserving of an opportunity.
Mhm.
Not that other people aren't, but she deserves an opportunity to do
Yeah.
something that she enjoys. And I think that she'll be very, very, very talented and very good.
I'm sure she will. She's learning from you.
Oh, thank you. It's hard. I do get a lot of requests and emails. Are you looking for a secretary? Are you looking for someone? And I'm really particular.
Hmm.
I think that people come to your business because they want to see you. They don't want to see
Okay.
someone else.
Okay. You're always good about getting back to people. I know anytime I've ever reached out, you get back. You're doing it all yourself, but you
I
you are
am.
doing it.
I feel like then it's done, quick and it's done right. So
Hmm.
I think that's probably one of my problems.
Well, it's hard. I mean, I do the same for my business. It's me. That's it, and
Yeah.
there's so many appointments in my schedule with being a mom and running businesses and a household. I mean, we know the invisible mental load and demands on women is a real thing. I talk about this in the therapy sessions with clients, and I don't just talk about it with women. I talk about it with men too, because I think that there's husbands and men out there that generally want to understand, but I just think we just operate a little bit differently. Right? Like they have things on their agenda that we don't have and vice versa. But when you're a mom who's running a business, probably more than full time, because does it ever really stop? Really, no.
No. I handle stuff even when I'm on vacation.
Yeah. Yeah. I mean, because you do have to, and you're prepping and you're booking out, and maybe somebody had a procedure and they got a question. It doesn't really end.
Girl, when I'm done here, I'm going to get a birthday present, grabbing my daughter, and I'm taking her to a birthday party.
I hope you have some cake while you're there.
Yeah, we'll see.
Treat yourself.
But and I left the house at a little after 8 this morning, and I don't even know how many patients we saw today, but it was
I'm sure it was busy. It's a Saturday. Yeah.
crazy.
Yeah.
Absolutely crazy. And I've had to open up even more days and hours. Just I can't fit everyone in. But it's a beautiful problem to have. I'm really thankful.
Oh, and I think your new space, you have room, like you said, expanding, bringing somebody on. And, I don't know at some point if you will have another injector, in your business, or what that's going to look like. I know you
Yeah,
have
we'll
Ezra
see.
too, who does like the facials and skincare. I think she does all therapy for you as well.
Yep. Yep. She does
Hmm.
hydrofacials, microneedling, dermaplaning, pills.
Yep. All of it.
Yeah, I don't know. I've never wanted to be a big practice. I like to keep it
Hmm. Contained. Yep.
yeah, and very personable,
Hmm.
so
If it
I
gets
don't
too
know.
big, you lose a little bit of that.
I
And
agree.
I don't want to call it control, because I feel like when we hear that word, we automatically have like a negative connotation to it. But if
That should be my middle name.
but I get it, right? There's a reason I don't have a secretary. There's a reason I don't have people that I take under my wing, because I'm already spread thin enough. And then when you're now overseeing other people, it takes more from you, because there is always going to be that oversight. There is going to be more involved from you, and you're one person.
Mhm.
So I think a part of this is, yes, you have a thriving business, but there has to be limitations to that,
Yeah.
right? You know?
I know. I do have to cut it off at some point.
Yeah.
Patients will say, I need to be in at this, on this day. I'm sorry. I can't.
Yep. Yep. I could put you on a cancellation list, right? I know you will post on social media if you get a cancellation, and then people
Yeah.
can kind of plug that in. But you're doing great, and
Thank you.
you got to stay on top of it and revisit it. And I think you've remained relevant for 8 years, and I don't see you stopping anytime soon.
No, there's no plan in that. And I do think, another thing that I learned from listening to a podcast is letting your business tell you when to grow. And I worked out of a very small room for 6
Hmm.
years,
Yep.
and I was seeing over 200 patients a month, and it was time for a little bit more space and doing something different. I know other people that have had businesses that they don't want to work as much, but yet they go and get a bigger space.
Doesn't make
What are you
sense.
doing? What are you
Doesn't make
doing? You're gonna
sense.
put yourself in a hole, and
Yep.
and 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 being in this industry too is expensive.
I was gonna say it's not a cheap industry. The machines, the product. I mean, we know everything's going up. You can't go to the grocery store and buy meat. It's gone up $1 million. So
Yeah,
of course,
it
this
is.
space
I
is
mean,
gonna
I
go up.
get that they're luxury and treatments, but it's also
The cost.
the investing that I have to do is tremendous, but I have to
Mhm.
have it here.
Mhm. Yeah.
I remember when I first started, I trained with a nurse practitioner. She did some hands-on training with me, and she said, Andrea, I was making more money working 3 days a week in the ER. And that's another thing, someone starting a business in a med spa is they will sell you everything and anything.
Of course. Yeah. Yeah. Yeah.
And that was another thing that I had to learn my first couple years. I said, I'm working my butt off. How did I only make this?
Yeah.
And she said, you're spending too much. That's
Yeah,
easy to do.
you gotta have a good accountant, and a good financial planner helping you manage that. I
Yeah,
have my accountant who is always I can send an email to, and he's kinda directing me what I need to do.
sure.
There's a cost to trainings too. I mean, I think about that too. Those trainings, getting those private trainings from that provider
I
was
still
was
do
not gonna
them
be cheap.
often. I do them a couple
Yeah.
times a year. I prefer one-on-one trainings. I don't really prefer group trainings.
There's a cost to that. I mean, I've had trainings one-on-one with people or consultation work depending on what I'm doing, and that's not a bad thing. It's actually highly recommended. I know in my field, I would assume in yours as well, right? Or more like you said, more complex cases. It's like doing case consultations with other providers and making sure that you're giving the best care to that patient, especially in more complex cases.
Yeah. And I always I learn something every time, even if it's going over the basics again. I still like to review it because
Mhm.
you always pick up something. If I can turn a needle a different direction, or I can change my concentration of something and just make it that
Mhm.
much better. I
Mhm.
don't know. I like that stuff.
Yeah. No, it's I think that's how you perfect what you're doing. I don't think plastic surgeons go in with I know everything all the time. They're constantly updating techniques or ways of doing things or something new comes on the market, you know.
Yeah, but you have to be aware of it. I mean, great stuff will come out, and I'll go to a lecture, I'll learn about it, patients will want it, and I'll say,
Not for me.
I'm not
Yeah.
bringing this on
Yeah.
because whether I learned that there's, a higher risk for an immune response to a
Mhm.
product,
Yep.
I'm good.
Yeah, no, you don't want
I'm
something
really
that's gonna create
picky
more
over the
issues.
years of
Yep, and you should be.
what I keep on the shelf because I've learned too much.
Yeah. Yeah, and I think that's another reason again to go to a provider that takes time to be invested in learning and knowing the research. And as time goes on, right, I think some of the newer stuff too that comes out, maybe it hasn't been out that long. Maybe it's only been a small population
Yeah.
that you think about too some of the research done by the drug companies with their own product. And it's, sometimes
You
you got to
can't
wait a
always
minute.
jump on the first and best
Yep.
thing, but,
Yep.
sometimes it's cool to have something that, for example, some of the skin boosters I have in the Micron Jet, no one else in the area has that.
What is that?
So so they're actually medical grade from Korea, the skin
Hmm.
boosters, but they're FDA approved here in the United
Hmm.
States. And then the Micron Jet is just a tip that instead of using a needle on my syringe, it's a little tip. It has 3 little crystals on the tip, smaller than my nail, really,
Okay.
really teeny tiny. And it allows me to just go underneath the dermis. And it would be similar to a manual microneedling,
Oh,
except I
okay.
can deposit a skin booster directly into the dermis.
Is this
So
the one that you do under the eyes?
yeah, so I
Yeah.
can do
Okay.
around the eyes, I can do scars. Obviously, patients need several treatments. I get the question a lot about what's better, doing your own plasma or doing skin boosters. In my opinion, I would do a skin booster over my own plasma.
Hmm. Something I don't
I
have.
want 5-year-old plasma. I don't
Yeah,
want
yeah,
44-year-old
yeah.
plasma.
Agreed.
So in that case, I would say go with the other skin booster than doing your own plasma, but you
Mhm.
need a couple sessions of both. I think that everything has its place. Also, I'm using the Micron Jet for hair growth
Yeah.
boosters that has specific the copper tripeptide to help with hair growth, and I can inject it right into the scalp. Um, it would be the same thing. Someone who is completely bald, you're
Mm.
not a good candidate. If
Okay,
you
so
have
that
a
was my
little bit
question. Yeah, so who's a good candidate for the hair treatments?
Yeah, I think someone that has a little bit of fuzz or regrowth would be a good candidate. Someone that is completely bald or has a bald
Mhm.
spot, I wouldn't want to if someone wanted to try it, I would be more than happy to try it. As
But
far
right.
as results, I wouldn't want to sell something that I don't think someone would benefit from.
Yeah,
Yeah.
yeah, so if the hair follicle is still growing and there's still hair, you're more likely to be able to stimulate that
Correct. Well, what
and
it
have the
does is it helps strengthen the root.
okay, okay.
Yeah.
Oh,
So
yeah,
and
so
I've
if
had
there's no
patients have
hair
really nice response with it, and it's a nice option besides PRP. I know my husband had the the PRP in his hair, and he had
Mhm.
to bite down on his mouth guard
Oh,
and said that it was so painful because they use a needle to inject it. He said it was
and that's
tremendously
sensitive.
painful.
Yeah.
This patients honestly say that it's a breeze. And again, I have the Pronox if somebody wanted it.
Mhm.
But yeah, so back to what we were saying about having something new and cool and being
Mhm.
the first one in the area to have it. I think that you have to pick wisely about what you're promoting. I mean, there are some other fillers out there and skin treatments that I have not brought on just because of maybe the science behind it. And
Mhm.
I just don't want to take those risks.
Yep. Yeah. Yeah, I mean, just because it's new doesn't mean it's better and it's not for everybody, and just
Yeah.
like
And
Botox and filler isn't for everybody either, right? I
they've
mean,
changed a lot. So injectables have changed a lot. Neurotoxin has changed a lot. Fillers have changed a lot. You know, people know it by brand name. It's like saying Kleenex.
mhm, mhm,
They want it because they know the brand name. But I do think certain things, I carry them because they still work,
mhm,
or else I wouldn't carry it. But I do have preferences over certain fillers as far as, if everyone knows Juvederm, for example.
mhm,
I'll
mhm,
get it if somebody wants it specifically, but my preference, I do prefer other products.
and it's
There's
okay.
science has changed the way it lays, the softness, the all of it.
Depending on
We all
where you're
we all have
putting
our
it.
preferences.
Yeah,
Not that
depending on
it's
where you're putting
wrong.
it. Yep.
Yeah.
Yeah.
Some people they only use Juvederm, for example. That's
Mhm.
fine. That's great. I don't think that there's anything wrong with certain products, but we all have our preferences. We all have our techniques. There's a lot of ways to get the job done.
Yeah. Yeah, no, I think you're doing a great job.
Thank you.
You're welcome. So, as we're, tying up our session, what would be a takeaway that you would have for clients who are interested or maybe have never gotten into Botox or filler or any of the services that you offer?
Yeah, so I think being prepared with budget
Mhm. Okay.
is really important. I think sometimes people don't have any idea of what it costs because it can be pricey depending on
Mhm.
what you do. So I think having a budget, I do offer a service called customized beauty plan where patients they might have not any clue. They think Botox goes in here. They just have no idea what
Mhm.
goes where or what's what. So they come in, I take photos. We review their photos together. They talk about what bothers them. I talk about my recommendations and
Okay.
kind of where do you want to start? Some
Yep.
people go for it, do it all. Some people, I want to start slow or I want to start here. What bothers you the most? So I try to address those areas that maybe bother them most. And then we kind of ease them into other things, especially skincare. We always talk about that because what you're doing at home, you want to protect your investment,
Yep. Yeah.
so and give attention to those areas. If someone says, "Oh, my neck has been bothering me." Okay, well, let's start to give it some attention.
Mhm.
Yeah, so I would just and I consult on everybody. You're not just going to come in and say, "I booked for my smile lines," and you're not going to sit in my chair and I'm just going to do them. That I don't
Yeah, have
roll
a
that way.
conversation. Yeah, yeah.
100%. I'll talk about structure building of the face and why you should maybe do some other areas or who's a good candidate, who's not a good candidate, why you're going to
Mhm.
get better results. So no one needs to feel nervous.
Yeah. And I think something to remember is that, especially with like fillers, there's like a building process too, right? There might be a little bit of swelling right initially because you are injecting,
Mm.
right? But then as things settle or as that collagen starts to form, they might be like, oh, I know like the first time I did my lips, like we just had a little bit, and then I was like, okay, I'm liking this. Now I need to come back and have a little more, right? It's a building process
It's a building
sometimes.
process and people see, one syringe is the size of a blueberry.
It's little.
It's
Yeah.
very little. So people, have that little freak out, but it's okay. I try to educate everyone the best I can and then, walk them through the process of, hey, if you love this now, you're going to want to come back and get a little bit
Yeah.
more and to know that it's not one and done. No offense to older patients, but if someone comes in and they're 70 and they want to purchase one syringe, they are going to be very dissatisfied.
Yeah. And that's
Uh,
about what I was just about to say. Somebody who's 20 is going to have a different result than somebody who's 50.
Yeah, a good rule of thumb that I will tell patients is a syringe of filler for every decade of life. So if you're
Okay.
40, 4 syringes will get you close to your goal. So
Okay.
that's kind of the
Rule of thumb when it comes to
yeah, a
what
little
am I
bit.
looking at?
Just to have, what can you expect?
Yeah.
And I'm not pushy.
Right. If they only want something real subtle and this is what they're at, all right, good to go.
Exactly. And I try to be mindful of
Needs. Yep.
everyone's stuff.
Yeah. No, I appreciate your time. I appreciate you coming on here. I know you are very busy,
Mhm.
and I'm grateful for you to come on and give a little bit of direction on what this looks like, what people should look for, and your journey as well. What led you into doing what you do?
Yeah, thanks for having me. And I think if people are searching, Google reviews are huge.
Mm-hmm. Mm-hmm.
It's a big part of business. Do your homework, find someone who's going to be honest with you and not just sell you everything.
Yep. Yep. Be able to tell you no if you're telling a patient no, you're doing your job. If it's beyond what you're comfortable doing
100%.
and if it's going to put them at risk.
So, yeah, I don't know. I am still taking new patients all the time.
Okay. I'll make sure you have a link in the description to your social media and to your website, and
Yeah,
they can reach out to you if they have questions. I know also you have online booking, which as a busy mom is amazing. And then you have prices on there too. And then I know some things are on there as consult, depending on what it is. They can always reach out with those questions as well.
absolutely. Yeah. So I think that there's a website people can email me. People do
Perfect.
Instagram me. I try to respond as I can, but obviously I've got my own life, but I still respond to it.
You'll get back to them. Yep. Yeah. Yeah.
Yeah. And I usually book out a couple weeks. So if somebody wants something right away, I do recommend that they
Plan ahead.
book sooner than later. Things do open up and things do pop up, but it's really hard for me to. I actually just opened up the next 2 Mondays, which I usually never
I
work
saw that.
Mondays because I just don't have the space for people. Which
Yeah.
it's a wonderful thing. I
It
feel
is.
very
But
blessed, but it's a lot of work. So it's something specific, they can definitely reach out. I do my own schedule, so if I need to come in a little early or stay a little later, I don't mind doing that within
yeah.
reason.
Which means, make sure you're taking care of you. Make sure you're taking those breaks. I know
I
you'll
know.
hit up somewhere sunny and warm at some point and recoup. So
Yeah, and if anyone has any more questions regarding some of the stuff we talked about, I'm totally cool with continuing that conversation.
awesome. Well,
Yeah.
I hope people do reach out to you. You're a great provider. And thank you again. I'm grateful for your time and I will see you
And I'm
soon,
proud
I'm
of you
sure.
too.
Thank
I'm
you.
so
Thank you.
proud of you. You're following your little passion project. And
I
I shouldn't
am.
say
And
little. You're not following a little passion project. You are following a passion project.
yeah, yeah,
And I
it's
love
fun.
that.
I wanna get information out there and midlife I was one of those people that came in, I'm like, "What's happening to my jawline here? I used to have a nice jawline." Midlife hits us, and as women, I think it's hard, and I want other women, and men too, because men struggle too, but I'm speaking for women because I'm a woman, but it's hard. It's hard to navigate this. Even though I'm approaching, I still feel like I'm 20 something. I think through conversations and through doing this, we're helping to normalize things in life.
Yeah.
And that's
It,
huge to me.
it's
It's
really
everything.
about giving someone confidence because I think that if you
Yep.
feel like you look good, your energy changes, your mood changes.
Yep.
There really is
There's science behind it.
something behind that. If your
Yep.
skin looks smooth and a little glowy, and it's like, if you get a little suntan, you're like, oh,
Yep.
I feel like
Yeah.
I'm
Get a little
back.
pep in your step. Yeah.
Exactly. And so that's really a good thing. I want women to feel comfortable. I want them to feel confident. I don't want them to feel overdone. Lips shouldn't be the first thing you see on someone when they walk in a room. You know what I mean? It should be
Yep.
done tastefully. And I love that. My biggest compliment is when someone says, everyone kept complimenting me and saying how good I looked, and no one had a clue that I had anything done. And to me, that is the biggest compliment. So that's really my goal is in this industry, just giving women their confidence, feeling
Yeah.
good. I've had patients that have gone through cancer treatments, and
Hmm.
it takes a toll on
Yep.
them, on their
Yep.
skin, on the volume loss. It just takes a toll on them, and I love being able to give that back. So
Yeah. Yep. It's everything. It really is.
we're
And
all going through it.
we're all going through it, and if you can assist us with, I'm gonna say, aging more gracefully, then we'll take that. So,
Yeah,
thank
I'll
you
do my
again.
best.
Awesome. Thank you, and I will see you soon, I'm
We'll
sure.
chat soon. All right, Mindy.
Okay.
Thank you.
You're welcome. Bye.
Bye.
Before we wrap up, I just wanna share a quick reminder. This podcast is for educational and informational purposes only and is not a substitute for therapy, medical advice, or mental health treatment. If you're struggling or need support, please reach out to a licensed professional or a trusted healthcare provider. And as always, please don't be afraid to hit that subscribe button and give us a follow on social media. We love feedback from all of you. You are what fuels this podcast. Thank you.